Charlie Baker today appearing to falter on the initial plan to remove all health and safety restrictions for the upcoming school year.
This as the COVID-19 vaccine approval for kids under 12 is still months away. The back-to-school countdown is just weeks away. Western Mass News reporter Audrey Russo tracking cases in young people, and she's live in studio with more. Audrey?
If you're between 12 to 18 years old, you only have one vaccine option. If you're under 12, you have no vaccine options for COVID-19. That means a large number of unvaccinated people are set to learn again in close quarters this fall.
58% of our 12 to 15-year-olds has received at least one dose, compared to 36% nationwide.
The Bay State's population of vaccinated teens is relatively high, as state health officials pointed out at a hearing of the Joint Committee on Public Health Monday. But that doesn't mean kids aren't getting infected with COVID-19. Western Mass News looked at the most recent data for new cases over the last 2 weeks provided by the Massachusetts Department of Public Health. We did the math and found that out of more than 3,000 cases, around 14% are kids aged 0 to 14. When you add in teens 15 to 19, that number goes up to 20%. Officials with the Department of Elementary and Secondary Education, who declined to testify Monday, have said they will not require masks in school come fall. Governor Charlie Baker, ahead of a Tuesday call with federal health officials and the White House, says that's up in the air, though he was back to wearing a face mask himself.
I said all along that the one thing people should be very careful about is making absolute statements about anything that has to do with COVID.
Western Mass News also spoke with the chief clinical officer of Mercy Medical Center on the susceptibility of children to the virus.
Regardless of the age of the person, if somebody's unvaccinated, then they are susceptible to getting an infection.
And while children historically have not become seriously ill with COVID-19, Robert Roos says that may not always be the case.
It's very possible that these variants could also change and become something that's more severe for children than the prior variants that we've experienced. I think that's an unknown at this point.
The date for when kids under 12 will be approved for vaccines is up in the air, with some estimates as early as mid-fall and others as late as the end of 2021. Either way, health officials at the hearing today discussed different frameworks for setting up school-based vaccine clinics once that green light is given. Live in studio, Audrey Russo for Western Mass News.